Tria Orthopedics is a leading comprehensive center for orthopedic medicine in the Minneapolis-St. Paul metropolitan area. When Tria was designing new operating rooms, they decided to construct a facility that matched their commitment to the highest possible level of patient care. To help eliminate the risk of surgical site infection, Tria took their operating room design beyond what most healthcare organizations consider state-of-the-art and reached a level of patient protection that most considered impossible.
So my name is Gavin Pittman. I'm one of the orthopedic surgeons here who does predominantly total joint replacement. We'll take more or less any step we can to minimize the risk of having somebody develop an infection, especially from contamination in the operating room. We can clean the surfaces of the OR very easily. We can clean the floors and we can clean the lights and so forth, but keeping the air clean is something that frequently would be beyond your control. The less particles that are floating through the air near the operative field certainly is going to decrease the risk of contamination during the surgery.
To guarantee results, Tria turned to the only company that could eliminate all particles from the air in the operative field.
I'm Ted Folstad with SurgicAir Products. I am the Vice President of Engineering and R&D. I have been intimately involved in all aspects of the development of the SurgicAir Zero system. At SurgicAir, we believe every OR in the U.S. should have zero particle air.
For over 45 years, SurgicAir has been the leader in operating room airflow control. Extensive testing in SurgicAir's in-house research lab identified inherent flaws in current OR airflow techniques that actually contribute to surgical site infection, a finding that current literature confirms more each day. In all current ORs, laminar flow actually draws particle-laden air from the perimeter of the room and delivers it directly over the patient. Even with the best filtration available, the operative field is continuously flooded with contaminants. To solve this problem, SurgicAir created SurgicAir Zero, the first and only system to achieve and maintain zero particles in the operative field. SurgicAir Zero is a comprehensive air control system that can protect the patient from both activity in the perimeter and contaminants generated by staff near the table, as demonstrated by this real-time particle count during surgery. While particles and bacteria are continuously shed by everyone in the room, none of them reach the patient. There are no air cleanliness regulations for operating rooms and no prescribed number of particles that are allowed to reach the patient. SurgicAir, like Tria, decided that the only acceptable number of particles is zero.
When that particle counter drops to the true zeros, straight zeros, everyone that sees that is absolutely astounded. And it is a remarkable level of performance.
The main benefit long-term is to minimize infection risk, and we're a year into doing outpatient hip and knee replacements in this facility, and we have not had any infections. So I think we can use that as a barometer that this system seems to be working well.
Most engineers, administrators, and physicians would agree that even if one surgical site infection is prevented, the investment in SurgicAir Zero will have been worth it. SurgicAir Zero is a revolutionary achievement in patient protection and the only measurable performance improvement in OR airflow in over 30 years.
There is no doubt in my mind that ultimately this will become the industry standard for any facility that strives to be a center of excellence.
See for yourself how SurgicAir Zero can reduce infection rates by eliminating surgical site airborne contaminants at PrecisionAirProducts.com. Why settle for less when you can have zero?